Good evening, folks. Now, today's topic D, rethinking medication administration in post-stroke dysphagia patients. For decades, the default approach to for medicating patients with post-stroke swallowing disorder has been to crush tablets under the assumption that smaller particles are easier to swallow and less likely to be aspirated. However, new evidence from a fiber optic endoscopic evaluation of swallowing, that's a FEES study, challenges this assumption and suggests that whole tablets, when paired with a soft food, like broths, like applesauce, may actually be safer and more effective for many patients. Using FEES, researchers directly visualized how patients with post-stroke dysphagia handled different tablet preparations. They compared the swallowing of one crushed placebo tablet with three types of interact placebo tablets, each administered with applesauce. This method allowed clinicians to observe penetration material entering the airway, aspiration material passing below the vocal cord, and pharynx. Residue material left behind in the throat after swallowing. Surprisingly, whole tablets were often swallowed clearly without signs of aspiration or penetration. In contrast, crushed tablets left significantly more residue in the pharynx. This residue can pool and later be aspirated, posing a hidden risk. It may also interfere with drug absorption, especially for medications that rely on specific dissolution profiles. Why this matters clinically. These findings have important implications for clinical practice, safety, reconsidered. Crushing tablets may not always reduce aspiration risk. In fact, they may increase the risk of residue related complications. Things left behind in the throat, guys. Absorption concerns. Residue from crushed tablets could impair drug effectiveness, especially for medications with narrow therapeutic windows or modified release formulations. Individualized care rather than defaulting to crushing. Clinicians should consider instrumental swallowing assessments to guide medications medication administration strategies. This could prompt a shift in nursing protocols, encouraging more common sense decision making that accounts for tablet formulation, patient specific swallowing psychology, and the nature of the bolus. Nonsense and limitations. While promising, the study has boundaries. Placebo use. The tablets tested were placebos, so the pharmacological behavioral of real medications wasn't assessed. Bolus specifically, applesauce was the only food used. Other textures might yield different results. Tablet variability. Not all tablets are crushed equal size. Coating and dissolution properties vary widely, and some medications must not be crushed due to safety or pharmacokinetic concerns. Therefore, while the findings support a more individualized approach, they don't suggest abandoning tablet crushing altogether. Just rethinking when and for whom it's appropriate. Broader implications. The study invites a paradigm shift in how we approach medication administration for vulnerable populations. It underscores the importance of integrating swallowing assessments into routine care and tailoring interventions to the patient's actual physiologically rather than relying on blanket practices for stroke survivors. This could mean safer medication delivery, better therapeutic outcomes, and fewer complications related to aspiration or ineffective dosing. In short, whole tablets, when thoughtfully administered, may offer a safer, smarter path forward for many patients with post-stroke dysphagia. Okay, folks, so that is your D for you. I will see everybody tomorrow evening for shows. Till then, Gator Wellness, take care, folks.